Welcome to the Purr Podcast, your favorite feline-focused podcast, where we dive into all things feline, medicine, surgery, behavior, and of course, a sprinkle of veterinary gossip along the way.
I'm Dr. Jolle Kuppenstein, feline fanatic, surgery nerd, and self-proclaimed lover of all things awkwardly cat-related.
And I'm Dr. Susan Little, proud cat vet, podcast enthusiast, and your guide to the wonderfully weird world of feline medicine. Let's get started.
Hello, this is Dr. Jolle Kuppenstein, and
this is Dr. Susan Little, and you deliberately waited till I had a cup of coffee.
Okay.
Yeah, so I am not. That doesn't count as a flubbed intro. Yeah, I just want to, and I have a witness.
This is the Purr Podcast, by the way. You did really well. I have to congratulate you because I was sneaky this time, but I tried to.
Just one time.
Yeah. If I could.
Yeah. And our poor guest is looking confused here. I routinely flub the intro. That's what they.
For some reason, we have only done 190 of them. I think 153 a intro that was less of ideal.
Yeah, there's no do-overs.
There's no do-over because everything is live here. So that's the way it is. But let's introduce our amazing guest.
Yeah, so we're recording this episode in Minneapolis. We're at the American College of Veterinary Internal Medicine meeting, which is where all like the real internal medicine people come, I feel like.
The real one.
And so we have Dr. Amir Kol with us. And we're very happy. You're a first timer, or as
a virgin,
or as Tears has said, a virgin. Yes, yeah. You can see you're going to have to blame her for a lot of it.
I like virgin.
Yeah. So we really.
It's actually like the first time ever on any podcast. I'm a real virgin. That's exciting. Like, wow.
Oh, I think you get a button for that actually. Yeah. It'll be coming in the mail. Yeah, it'll be a button. Yeah. Yeah. So I know that you've had one talk to do, one with Terza, right? That you did, or
yes. So we're in the same session. The talk is independent, but it's in the same session about FIP.
Yes.
In the context of immunology.
Yes. So of course, FIP is kind of big news again now. So yeah. Anyway, tell us a little bit about yourselves.
So my name is, as you said, Amir Kol. I did my DVM studies back in Israel. I grew up in Israel. And then after I graduated from vet school, I looked into residency opportunities in clinical pathology. We didn't have any at the time in Israel. And I was lucky enough to be accepted at Davis. So then I relocated. Initially, I thought that it's going to be just, I'm just going for a residency 3 years. And then I had the residency, and then I stayed for a PhD. And then ultimately, I got a faculty position. And Davis is
how they lure you in.
And Davis is a fantastic place. Really like it. I have 3 girls, 3 daughters, teenagers. One of them actually started college this year. So that's
my sympathies.
Yes.
My son.
How old were the girls when you moved?
So my oldest one was 4 years old. My youngest one was negative 2 months.
Oh, wow.
So my wife traveled with a big belly.
You have a brave wife.
She gets all the accolades.
She gets
brave
all wife.
The accolades.
Wow.
Yeah, wow. Yeah.
She is very
So clearly there's stuff about UC Davis you liked because you
Well, I mean, the university itself was a really awesome place to be trained in. It's, people are nice. For me, it's, that's a really important factor. People across the board were really nice, collaborative. And you get to see lots of different people, lots of very smart people. You get to learn from lots of people, hear different opinions. And that was a great environment for me to kind of grow in.
Mm-hmm.
Right. And this town itself, I don't know if you've been there. But
many times.
So I really like the town. It's kind of boring, but there are lots of things to do around.
I like college towns.
Yeah.
College towns are cool.
Yeah. And, I love the outdoors, and it's really close to the Sierra.
Yeah.
Are you a biker?
not a biker, a hiker. And then in the past few years, I've been doing some more climbing stuff and essentially really anything outdoors, like running and kayaking when I have a chance, or anything outdoors.
Is there water there? I thought it was in the desert.
No, there's plenty of water. Actually, plenty of water in the Sierra. It's like,
Of course, the Sierra. Yeah. I forgot. That's pretty close by.
Yep.
Right.
Oh, great.
But the town itself, so I am always surprised that, so you're in San Francisco and you drive over the bridge, and so everything is green in San Francisco and misty and that sort of thing. You drive over the bridge and then it is.
This is crazy.
Barren.
When I was a kid, we had a book with Mark Twain quotes, and it had there a quote where he says that his worst winter was summer in San Francisco. And I never got it until I got it. It's just mind-blowing. It's like, you're in Davis, it's 110 degrees, and then you drive for an hour and a half, and boom, it's 60 degrees, it's foggy, it's windy, you need a jacket, and it's like, what is that? How could that be? It's like an hour and a half of drive.
Yeah, your microclimates, right?
Yeah, it's incredible.
Yeah.
But it's really intense microclimate. I've never seen anything like that.
Right.
But the heat would be a bit much for me.
The summer does get hot, but Israel is also hot. But the nice thing about Davis is that it's dry heat, and it gets cooler at night. So we get what we call the Delta breeze from the Sacramento River Delta, and that cools down pretty dramatically during the night. Like we rarely need to sleep with the AC on.
Survivable.
Yeah, exactly. Yeah, so it's not humid, and you get a break off the heat during the night, which is nice.
Yeah, absolutely.
After this geographical lesson,
let's here to talk about cats and FIP.
It's a podcast on the geography
of the San Francisco basin.
Yes.
No, but clinical pathology, how did you get interested in?
Yeah, because it sounds like you knew where you were going, right?
Very little. Well, how did it all... So, I guess in vet school, I think it also in second year of vet school, two things happened simultaneously, which kind of, piqued my interest in ClinPath, which was I had my ClinPath course, and I had a really good instructor. And at the same time, I started working as a technician in a big diagnostic lab. And at the time, I was really interested both in internal medicine and clinical pathology. But then life has its ways, and I got into clinical pathology, and I'm very grateful for that. So I really like that.
So how do you become a clinical pathologist? What do you have to do to reach the pinnacle of clinical pathology?
Oh, the high pinnacle of clinical pathology. Well, obviously you have to do a residency program, right? How do you get into a residency program? That's a different question. You have to show, there is not a clear recipe, and I can tell now that I'm on the other side when we review applications of residents. What is it that makes one candidate resident to elevate themselves to the top of the pile? It's a good question. I think that what I'm really looking to see is people that are really interested, have that curiosity and motivation. And honestly, for me, I want people that would be fun to work with. Again, kind of, it's
underrated, isn't it? Being fun to work with.
Yeah, just people that are nice to work with, right? That that it's not going to be a struggle. There's not going to be tons of drama, right? And it's just going to be fun.
So that's what I should have looked for when I was creating this podcast, I guess. Yes, I made a big mistake. Now I realize it. Thank you. But anyway, I think that's a really good point because, but your intrinsic motivation was you were choosing between internal medicine and ClinPath. And so when did you make that decision that ClinPath was the right thing for you and not internal medicine?
I think that it was, during my fourth year, so my clinical year in school, I went for an externship at Purdue with Rose Raskin. And I think that then I realized that might work really well for me. I really like that. And that's when, I think that honestly, it was just, sometimes life, you have your plans, but life has a different plan.
Right.
Luckily enough for me, I was, accepted at Davis. Could I have been internal medicine or GP or anything else? Sure, right? But life took me along this path, and I'm grateful for that. Like, I really like, thinking about disease, pathogenesis of diseases. And I guess for me, it was less about the treating the animal and having that, relationship, which I totally appreciate that other people have relationship, long-term relationship with the owner, with the dog, treating them, seeing them, how they, progress. For me, it was really kind of trying to solve the puzzle.
Yes, the curious mind.
Yeah, like why are they sick? Yeah. What is it that is driving that disease? And then obviously when you understand that, you can treat better, right? And that's what drove me into research as well, right? So kind of trying to better understand like what's going on, like what's wrong. And once you understand what's wrong, hopefully you can better tailor treatments.
So what's an average workday for you look like? Are you in the lab a lot? Are you in your office a lot?
I'm in my office a lot.
You're in your office.
Yeah. So my primary position is research, right? So I do research, I do clinics, and I do teaching, right? So when I'm on clinics, I mostly work, at the diagnostic lab with our residents, and I train residents, and then we don't have students that are rotating through our service regularly, no, but we have but people are coming kind of, clinicians and students, they come down all the time to talk to us about cases, and we work with residents. So that's kind of when I'm on clinics. I'd be most of the day, I'd be, at the clinic. We do mostly, cytology and hematology. That's our kind of bread and butter. But I do clinics about, maybe 12 weeks a year.
Okay.
And then the rest of my time, there is one bulk of the year where I do most of my teaching, like a few weeks where I'm doing mostly teaching. And then the rest of it, I'm researching. My research, I don't go into the lab anymore, so I'm not doing, I've never really enjoyed that much that part of the research of like pipetting and doing, and I'm not that good at it. But I found out that I really enjoy the training part of it and seeing my graduate student kind of progress with their career and how the impact that I have on their career trajectory. And, writing grants, I think that writing grants for some reason has a negative kind of not a good reputation.
Right.
I actually, that would be I actually find writing grants as, one of the most enjoyable parts of the work. Not enjoyable in a way that, it's not like going to an amusement park, but it's a part where you get to be most creative.
You're that one guy who likes writing grants.
That's why they kept you.
No, but really,
he likes writing grants.
Because that's the part where you get to imagine, right? You get to be creative and say what you think is going on. You get to hypothesize whatever you want. You can say like, I think that this is because such and such, and this is how I want to attack that problem. This is what we'll do, right? And then later on, you actually have to deal with real data, right? When real data is always messy, right? It never fits a perfect picture, and you have to figure it out. And it's also fun, right? Because you actually have to, figure it out. But when you're writing the grant, this is where you paint a much clearer picture, right?
Cleaner.
Yeah, exactly. Later on, you have to deal with reality, and reality has lots of noise in it, right? And you have to figure out what's noise and what's. So yes,
so true.
So that's me. I'm that one person.
So if I remember correctly, one of your interests is inflammation. Are you sort of an inflammatory guy, or not specifically?
I wouldn't say that I'm inflammatory guy.
Well, not personally.
No, of course. No. My focus my research is about stem cell biology and its application to regenerative medicine and disease modeling. Okay. And I have long lasting kind of interest since my PhD with MSCs. And MSCs, or mesenchymal stromal cells, people oftentimes call them mesenchymal stem cells. And but they're not really stem cells. We don't use them in order to, build new tissues from scratch. We don't expect them to differentiate in the body.
True.
What they do really well, though, is modulating, inflammatory processes. They're really good at they secrete lots of factors that help in regenerating injured tissue, right? And inflammation would be a generic response of the body to any tissue injury, no matter what's the cause of that injury. The first response would be inflammation. And oftentimes inflammation persists and becomes a problem itself. So MSCs are very good at modulating inflammatory processes. So this is my angle to inflammation.
So does that mean there is the FIP angle, right, which really needs some modulation, right? So is that one of the areas that you're looking at?
Yeah, FIP. It's kind of
strangest disease.
It's I'm not a virologist. I'm not trained as a virologist. And you'd ask me, 5 years ago, I'd never thought that I would work on FIP. It's a really fascinating disease, actually, and it blows my mind how there is, as NIH, for example. Like, if I were at NIH, I would be really concerned that a disease like FIP, that humans would develop an FIP-like disease, right?
Yeah.
And I would put a lot of research into trying to understand the pathogenesis of this disease, because if that thing goes into it won't go into human. But human developed like an FIP-like.
Wow.
Yeah, that's a wow, right? So, sorry. So I guess that for me, it started way back. We actually with HIV, where we knew that MSCs are very good at downregulating inflammation. And I had a collaborator at the time. She is still working on HIV, and we wanted to see, everybody knows that HIV is obviously immunodeficiency virus, right? It causes immunodeficiency. But the thing about it, HIV would, I didn't realize, I didn't think about that is, while at one hand it causes, immunodeficiency, it also causes massive inflammation and overreactivity of the immune system. On the other hand, that causes a lot of tissue injury, right? So we had thought maybe we could use MSC to downregulate that, the cells that are going just crazy, causing lots of tissue damage because of that inflammation. And that was successful, but what we actually also figured out is that MSC, other than down-modulating inflammation in HIV, also really made the HIV-specific, the good immune response much better. And we weren't expecting that. So then I wanted to see if I can go and apply the same kind of concept to a veterinary-focused disease. And, for me, it was at the time where just the pandemic came by. Obviously, FIP is a coronavirus. There was more interest in NIH with coronaviruses. So, again, I was lucky enough to get funded to study how MSC could be used in the context of FIP and how could potentially they kind of fine-tune, not down-regulate, but fine-tune the immune response in FIP.
Yeah. So in a way, the COVID pandemic opened a few doors, I think.
Oh, for sure.
Yeah.
For many people.
Yoel and I were talking about, with Teresa, for a previous episode. Yeah. So we've been talking FIP a lot at this meeting. We were saying that at the beginning of the pandemic, when researchers knew it was a coronavirus, I hope they talk to vets, because we do know something about coronaviruses, and we know something about coronaviruses that are nasty. So it's good to see some collaboration came out of it. I suspect not as much as there could have been, though.
Yeah. My question is, will this continue, or will human medicine now say, okay, this part is over?
We don't need you
anymore because they know a little bit. But
Corona, you mean?
Yeah.
I think that I can't imagine. like look at also, I mean, HIV, right? The HIV pandemic that kind of broke in the 80s. Obviously, it's still a huge problem, although, much less than it used to be. We know how to treat it, and people mostly can live a long, somewhat healthy life being HIV, at least in, Western world. There is still tons of research, and it's a huge challenge. So I can't imagine, coronavirus going anywhere anytime soon.
So I think at one time, there was quite a lot of research crossover between HIV and FIV in cats, right? But I'm not sure. Do you have a feel for if there's still so much? Because it popped in my head when you were talking about modulating the immune response in the HIV patients.
Yeah.
Right?
So, again, I don't have much. I'm not a virologist, right. So, my previous research was not in necessarily viral diseases, but I've been working with Brian Murphy, and he's a pathologist at Davis, and he's a pathologist and virologist. He's been working on, FIP and FIV for a long time. And so I know that he struggled a lot with getting NIH funding for FIV, trying to convince him that it's a useful model for HIV. I think that initially there was some, in the early days of HIV, when Niels Peterson and my collaborator Satya Dandekar on the human side, they were working, I think that FIV was initially looked at. And then for, I don't know all the history and whatever, but I know that right now it will be probably almost impossible to get money to FIV research, arguing that it's a good model of HIV.
Is it a good model?
I'm not sure. I don't know enough about it. FIV, I guess, the fine details. But I do know that it's in NIH, they don't look that favorably.
Is FIP a good model?
For what?
For coronavirus.
Yeah.
People.
So, my grant was focusing on a rare complication of COVID in kids that is called multi-system inflammatory syndrome of children, MISC.
Okay.
Right? It's a really interesting disease where kids get exposed to COVID. They may have a very, unusual COVID disease, right? So they don't get super sick. They get just regular, COVID where, it's a flu-like disease. But then a couple of weeks later, they come up with this really devastating multi-system disease where it affects multiple organ systems, super inflammatory. And these are kids that are otherwise, happy, healthy children with no other complications, and they can die from that. So it's pretty rare.
Right.
Like in the U.S., throughout those, how many years are we now post-pandemic? Like more than 4 years, right? And I think that there are less than 10,000, just a little bit shy of 10,000 cases.
That's still a shocking number.
Yeah. But
so what's the driver of that? Like what?
That's an excellent question. So initially they thought that it's just some dysregulation of the immune system, that the immune system just for some unknown reason kind of goes crazy. But then a few autopsies actually showed that, the virus is still there. So initially they thought that there is no virus because they couldn't find it on PCR, either in blood or in swabs, right? But the virus is in the organs, in the tissues, right? So, if you have, like in FIP, if you try to find the coronavirus, you won't find it in blood or, right? So you can find it if the cat has ascites, it will be in the ascites, right? But it's not shedding it. Right. So you can't put a swab in the nose or take a blood sample, right? So the same for these kids. So if you yes, but they do have virus kind of infecting their various organs. So it is probably driven directly by virus infection and also a combination of, an aberrant immune response towards this virus. But why does it happen in these specific kids? That's a great question. It's very similar to the cat.
It makes you think, like if you think of the gazillions of cats that get coronavirus every year, right? Why do only a handful do this?
So you wrote a grant. In the next episode, we'll talk about if you got it and what you're doing with it.
There's a cliffhanger. We're just getting into the meat of it, and I want to know. I want to know what happens.
I know. So it's going to be very exciting. So in 2 weeks, we will
talk about the fact that you wrote this grant, and you like writing grants, so you probably fluffed it up like I'm going to find
No, it's hard work.
resolution for everything. But great, thank you for being on the
absolutely.
show
Thank you
with
for
us.
having me.
This is the Purr Podcast, where we talk cats, laugh a lot, and learn something new every episode. Together, we bring you the latest updates, surprising cases, expert interviews, and just a touch of chaos, because nothing with cats ever goes as planned.
So whether you're a seasoned veterinary pro, a new grad, or you're just here for the cat puns, you've come to the right place.